Welcome to This Explainer. Today, we're unpacking the fascinating biological mechanisms behind exactly how diabetes accelerates the destruction of periodontal tissue. If you've ever wondered how a systemic metabolic condition manages to specifically target the gums and bones in our mouth so aggressively, well, you're exactly in the right place. We are going to break down the science step by step.
Right, let's just dive right in with the most critical question. Why exactly does diabetes turn the mouth into an absolute battleground and dismantle our gums? We aren't just talking about a slightly increased risk for a minor toothache here. We are looking at severe, highly accelerated tissue destruction that is driven entirely by systemic forces. To map out these biological systems under attack, we'll be looking at the inflammation overdrive, a broken defense system, structural collapse, starved tissues, and then we'll wrap up with a final takeaway.
So, Section 1, the inflammation overdrive, the system on high alert. When you contrast a normal cellular baseline against an unrelenting inflammatory state fueled by high glucose, well, hyperglycemia acts a lot like throwing gasoline on a fire. Instead of resting when there's no immediate threat, the immune system gets tricked. It becomes locked into this constant, low-grade, yet highly destructive state of alert. And this exaggerated host response triggers an absolute flood of specific inflammatory mediators. We're talking IL-1 beta, TNF-α, and PGE2. Now, you don't need to be a biochemist to understand what these do. Essentially, they're the chemical messengers that literally command the body to break down tissue. And yeah, that ultimately leads to significantly increased bone loss in the jaw. Moving to Section 2, a broken defense system, driven by neutrophil dysfunction. You might assume that more inflammation means a better fight, right? Actually, scratch that. Diabetes causes neutrophil dysfunction. Neutrophils are basically your immune system's first responders, but under high glucose conditions, they act like bouncers who are asleep on the job. They're confused, sluggish, and just far less effective at actively fighting and neutralizing biological threats.
So this creates a really dangerous double whammy. While the destructive inflammation is raging and damaging the host tissue, the actual bacteria are surviving much longer in the periodontal pockets. Because these compromised defenders just can't clear them out, the harmful bacteria get to stick around and multiply. Meanwhile, the host's own misfiring immune system is accidentally burning down the house. Which brings us to Section 3, structural collapse, collagen breakdown. To really grasp this structural collapse, we need to talk about AGEs. That stands for Advanced Glycation End Products. Basically, these form when proteins or fats combine with sugar in the bloodstream, and they accumulate directly in the tissues, fundamentally stiffening the collagen. It makes these microscopic fibers super rigid, brittle, and just so much harder for the body to repair. It sets off this deadly biological chain reaction of poor collagen turnover. Step 1, because of these AGs, new collagen forms really poorly. Step 2, the older, stiffened collagen breaks down way faster than normal. And Step 3, the inevitable result. The periodontal support severely weakens. The literal scaffolding holding your teeth in place is essentially rotting away.
Now for Section 4, starved tissues, delayed healing.
Diabetes causes major microvascular damage. What does that mean? It means the walls of the small blood vessels in your gingival tissues physically thicken. Just imagine a pipe where the walls are getting thicker and thicker on the inside. The actual opening for the liquid to flow through, it just gets smaller and smaller. And this vascular thickening acts like a massive roadblock. It severely reduces the delivery of vital oxygen and essential nutrients to the very tissues that are desperately trying to survive this bacterial attack. It's crazy. The gum tissue is essentially suffocating and starving at the exact moment it needs the maximum amount of resources to heal.
Because these tissues are so starved of oxygen and nutrients, routine clinical treatments suffer from dangerously delayed healing times. If you compare it to a normal clinical recovery, well, procedures like routine scaling, periodontal surgery, or tooth extractions, they just can't bounce back. The local environment simply lacks the biological materials and the blood flow needed to rebuild. The source data actually pinpoints a critical clinical threshold here. This delayed healing becomes especially slow and highly problematic when a patient's HbA1c levels climb above 7%. That single metric is a massive red flag. It tells us the patient's internal healing environment is severely compromised.
Which leads us to Section 5, the final takeaway, systemic breakdown. So stepping back and reviewing the evidence, we clearly see this comprehensive systemic breakdown across three major bodily systems operating right there in the periodontal environment. First, the immune system is locked in constant dysfunction. Second, the structural system is completely crippled by AGEs and poor collagen turnover. And third, the vascular system is choked by vessel thickening, leading to severely delayed healing.
I'll leave you with this final, kind of provocative thought based on this whole biological domino effect we've mapped out today. If the mouth's defense, structure, and supply lines are completely compromised by systemic glucose, can we truly treat the gums without treating the whole body? Think about it. It really shifts how we need to look at oral health. Anyway, thank you so much for joining me on this explainer, and as always, keep asking the big questions about the incredible biology going on just beneath the surface.